With me today. I'm really happy to connect with you about the resources and opportunities that we have available to our students through our Wellbeing and Health Promotion Department at SDSU. Those of you who are joining us today or watching this later may have also tuned into the ECRT presentation, so there'll be a little bit of overlap because basic needs does fall in our area, but I'll really try to highlight some of our mission and kind of theory behind what we do, and then also the other opportunities that we have outside of basic needs and crisis support. So I'm Stephanie Gallia. I'm the Director of Wellbeing and Health Promotion. I'm plugging our website because we just got a revamp this semester, which I think is much more user-friendly and easier for not only staff and faculty to use, but also for our students to navigate themselves. So if you haven't been on there in a little bit, then I encourage you to take a look. We're really trying to make it, we have a lot of info on our website, which is something that we hope to be a little more succinct about in the future. But for now, we're really just trying to make it as user-friendly as possible so that when people come to us, they can dig if they want info. But really what's right at the forefront is services. And we know that's really why students are coming to us. And staff and faculty as well. So please check it out when you have time. Just a little background on me, I was a grad student at SDSU and started as a graduate assistant in the department, and then worked as a health educator for several years, and now have served in the director role for almost 4 years now. So it's been a great experience. I've been with the department for quite a while and seen it go through lots of different transformations, as we all do when we stick around long enough. And it's been really great to see it grow. And one of the things I'll also mention is that we're always looking kind of for those newer opportunities. So if you ever feel like there's an area where your students need more support, or a topic that we could be covering more comprehensively, then please do not hesitate to reach out, because a lot of our programming and development and growth has occurred over the years due to need. So either us doing a needs assessment or us being called to action by our colleagues and students, and we want to be as responsive to that as possible. So I put in this little quote from C.S. Lewis. This is why the little decisions you and I make every day are of such infinite importance. And I think this really speaks to the work that Wellbeing and Health Promotion does. We are holistic. We really try to focus on the things that our partners don't focus on and fill in those gaps, and pull the pieces together for our students. So we have counseling and psychological services who really focuses on that. The delivery of counseling resources and services, mental and emotional health. We have our student health service, of course, who focuses on physical health and wellness. We have great partners like Aztec Recreation, who are giving people opportunities to move their bodies and improve their physical health and gain opportunities to exercise, and lots of other, honestly, tons of other wellness resources on campus. And what we're really trying to do is take the holistic approach. So bring in the awareness, the health education, and the prevention side. And so we kind of do the front end of that prevention. We do the awareness, the overarching, and then we're also hoping to always cue students to action, which I'll talk about a little bit more later. But one thing that we really always have in the forefront of our minds is that we know that when students are working on maybe changing a behavior or making healthier choices, we're not looking for perfection from them, and we're typically not encouraging perfection. We're really trying to understand what their motivations are, what their goals are. Hopefully those goals include staying at SDSU, performing well, gaining success in a variety of areas of their life, and ultimately graduating. And so we want to help them, kind of our primary focus is helping them to avoid any sort of illness that would hinder their ability to meet those goals, and then taking it a little further and helping them thrive and reach a more optimal health, if that's something that is within their scope of possibility during their time at SDSU. So, I just like this quote because it reminds me a lot of what we focus on with our students, which isn't, make healthy choices the healthy choice every single day. We really see things as a continuum and a spectrum, and we want them to be progressing in a way that matches their values and their goals, even if that's incremental. and we want to be there to support them through that process. So we are typically located, our physical office space is located in Cal Poly Center, along with counseling and psych, student health services, as well, and student ability success center. So right now, during COVID, we are off campus. We're entirely virtual, our department. But I'm really proud to say that we haven't pulled back on any of our services to our students. So the only thing students can't come in and do right now is come in and grab condoms, but we have moved that over to student health services so they can do that student health services. And of course, we can help a lot of our students aren't even local, so we can help them right now in finding ways to discreetly order those or obtain them in a way that's accessible. But that's really the only thing that's off the docket. So everything else we'll talk about today, we normally offer and we have continued to offer. And we're really excited. You know, we'd already had on our radar before COVID the need to go into telehealth to some extent. I mean, we're not doing healthcare, but the need to kind of go in this virtual capacity. We know there's students in Imperial Valley. We know we'll be having students in Mission Valley, and we have, you know, students who at certain times it just doesn't work for them to come into our physical space. And so we were already kind of stocking up on items we would need to do that. So the transition worked really well for us, and we've been able to maintain a really pretty good numbers on how many students are accessing our resources. So with your help, we hope to see those even rise further. But we normally would be there, and we definitely take students in all the time. You know, we have students who kind of walk in, chat with us. Some students have appointments to see specific people, but lots of students just kind of wander in and ask about our resources and get connected to anyone on campus that's a health and wellness resource by walking into our space. And that's something that we of course encouraged before COVID and are anxious to encourage again after we reopen and have our staff back in the office. So to cover a little bit of what we do, we're pretty broad, as I mentioned, but of course, one of the things that we heavily focus on and one of our primary goals is health education. Just like any other kind of wellness or well-being department on other campuses. We do group presentations or demonstrations. Here you can see some examples of someone kind of talking to students in a small group setting. And then also we have you may have seen our Moby out at the farmers market or around campus. And so we have a mobile demonstration kitchen that we take out to showcase to students how easy it is to prepare and cook your own food. So we do a lot of things like this, really that hands-on presentation, group education. And one of the ways we typically see a lot of students is through registered student organizations requesting group presentations, residential halls requesting group presentations, and then also classes. So we're available for folks who are, if you're teaching a class or overseeing a group of students, and perhaps you know our pre-made presentations fall in line with the curriculum, or maybe you want something new and you just think, hey, I need a guest speaker. We've frequently developed presentations based on the need, as I mentioned before. So we see a lot of action kind of in those three areas. We also do a lot of one-on-one education. And then I should mention that we're actually still doing these things. So we offer virtual presentations, of course, just like we're doing right now, right? That's the obvious one. But we are still doing cooking demonstrations and other demonstrations. Some are pre-recorded, but we're also doing a lot of live. And we're not getting huge numbers, but we do have people consistently, new students kind of check in and attend our live demos for cooking and also for our GYN orientations, which is focused on contraception and gynecological appointments. So that's been great to see the students still coming forward for those things. We also offer, and this has been really heavily used during COVID, one-on-one education. So we're able to, our health educators and other subject matter experts in our department are able to connect with students one-on-one via Zoom or phone and help them better understand a topic of interest. So the main ones that we have offered are nutrition is one of our most heavily requested. We don't do diet plans per se. We focus on an intuitive eating model, but we can talk to students about meal planning, about holistic health and eating, about making sure that you're eating enough for your exercise regime, or how to prep foods. We talk a lot with students who are on meal plans about how to make the most of what they have available to them. So we can do all of those things with nutrition, and we've had tons of requests for that. We also offer, and I'll talk a little bit more about this in a moment, but healthcare literacy. So anytime a student needs help utilizing their healthcare, understanding their healthcare, even doing like an appeal for a bill, we can help students with that in a one-on-one capacity. Kind of one of our bread and butter items is sexual health. So of course we offer one-on-one consultation on contraception and sexually transmitted infections and a variety of other sexual health issues. We continue to offer pregnancy options counseling. So for folks who are pregnant, we are able to talk to them about local resources and just help give them, we of course don't help students make a decision about a pregnancy, but we help give them information based on whatever direction that they're hoping to go with that pregnancy. And we have expanded this. So if a student's not local, then of course we can help a student find resources in their current area as well, which we do with all of these topics. We also are continuing to offer our Narcan Upstander distribution program, which is a partnership with Student Health Services, where we're able to train our students on how to use Narcan, which is designed to stop an opioid overdose in its track. It's a medication that can be easily administered with no negative side effects and stop an opioid overdose. So we're able to educate the student in a 45-minute to 1-hour training. And then if they're local, they can go pick it up at Student Health Services at no cost to them. So that's been something we're really excited to continue offering. And then of course we consult with students about other alcohol and drug education as well. One that we've had a lot of interest in lately is sleep. So we do offer one-on-one consultation for sleep as well. And then after COVID started, my team really came together and identified the need for a self-care and emotional assessment. So that's something new on the docket where students can come to us and get one-on-one education on, and it's really based on where they're at, right? So we talk to them about where they're at, and then we can help guide them and give them some really specific goals, and they can come back. And then one of also the more recent additions to our kind of laundry list of one-on-one education is health coaching. So if you have a student who maybe is doing really well and they want to do even better, right? They're like, I want to be able to get even more sleep or go down a more consistent sleep schedule, or I'm really interested in training for a half marathon or something like that. They're really in that thriving space. Then we offer health coaching, and our community resource specialist is a certified health coach. So she's able to work with students, again, at no cost to them, for several months on some of these more, I would definitely put that in the thriving area, right? Like they're doing really well and they want to really do even better. So we have kind of this spectrum of for the students who may be struggling with their self-care, and also for the ones who really want to build on success that they've had with their health behaviors. We also, and it's very simple. You just go to the website and the student fills out a quick questionnaire, and then our subject expert who matches the best with whatever topic they're interested in will connect with them. And if a student, like I said, if a student maybe has a goal or is interested in a topic that they don't see listed on our website or I didn't cover today, we'll rally together to have folks develop a curriculum for them. So we don't shy away from doing new topics. We also have communication material that we're pumping out constantly, and social media is an even more critical part of this than ever before, with students being away from campus and with us being away from campus for the most part. We of course program to those students who are on campus as well right now, but we're wanting to make sure that we're communicating to the entire student body. If you haven't checked out our social media, please do. I think my team is doing a great job with it, so I'll definitely plug it. And we do our best to share other opportunities on campus as much as we can. So it's a good spot to get a lot of information. And then we really pump out anything that's a hot topic, kind of just trying to get people to remember that, virus transmission and COVID isn't the only thing we're dealing with right now. We know students have other mental health and physical health concerns. And then also timely updates we post on our social media. And then we also, of course, do support students and colleagues with identifying credible health sources. We know this can be hard in an era of getting a lot of info all the time, some of it credible, some not. And so we assist students as best as we can with helping them get those good resources. Like I said, we also focus on prevention, and we do this in a variety of ways. And one of the ways we do this, and we're still doing this, even though all of our students are not currently around SDSU, is environmental assessment and solutions. So making sure that we are assessing our environment, we understand what's going on. Are there triggers in the environment that are encouraging less healthy behaviors? Is there a way for us to not only remove those triggers, but also maybe increase access or cues to action so students are more encouraged toward healthier behaviors? So we're doing this type of assessment frequently and trying to make tweaks and recommendations to the rest of campus, whether that be, things about the bike lane or party environments, ways that folks interact in the residence halls. And then sometimes we even try to make recommendations to faculty, right? Like about times assignments might be turned in and things like that. So really trying to understand how do we shape the environment to encourage the healthiest outcomes possible for our students. We also offer peer health education. So we have really big programs in a variety of areas and topics where students who are interested in connecting with their peers about health issues can join. And we think this is really important. It's not only great for the students to get this experience, of course, for their resumes and their future career paths and just personal development by being educated and talking to their peers about health. But it's also important because, we have a team of 15 full-time staff and about 15 student staff, and we can't be everywhere. And so our peer health educators really help us kind of inundate all those spaces where we can't be available and help us share our message and information. And then we also really prioritize in our department campus partnerships and collaboration. We just see health as so big, and we can't tackle it all on our own, and not everyone comes to us. So we're only as good as people know about our programs and people partner with us. And so this is a huge priority to us as well. One thing that is, I think, really wonderful about what we offer, and I mentioned this briefly before, is our health insurance support. So we do have a full-time staff member, and then of course other staff who support these efforts, who really focus on health insurance support. So anytime a student cannot, and this is more timely than ever with students not all being on campus, but anytime a student can't get access to a resource on campus, or maybe needs any sort of specialty or long-term care that's outside the scope of what student health services or counseling and psych offer, that's when we get involved and we can meet with the student one-on-one. We help them utilize their health insurance to find a provider that will be able to provide this to them. We also help students gain that health insurance. We know not all of our students are insured. They all pay the student health and wellness fee, so they do have access. Again, not some of them, when we're normally on campus, that means they can go to student health services. If they're not local right now, then they can't, although they can't access the nurse line. And counseling and psych is telehealth, so they are able to access that as well. But we want to make sure they have health insurance, even when they do have access to student health services and they're all local. We need them to have health insurance for emergency cases, for specialty cases, for that long-term care. So we really work through this with them. And so we have developed really wonderful partnerships with off-campus providers who can assist them with Medi-Cal or Cover California enrollment, because we know it can be quite confusing. And so we're a one-stop shop. If the students come to us or to our website, they can just put their name on a form, explain that they're looking for health insurance, give us some basic information, and we'll funnel them to the right partner to help them get that health insurance as soon as possible and navigate those choices. And then we provide that one-on-one counseling for them if they need to find that provider, or like I said, if they have a bill or something like that. I'm sure I've been in this field for a while, and I have chronic health condition myself that I've been managing since I was very young, and I still find it tricky to navigate health insurance. And I'm sure a lot of other people are in that boat. So we know our students struggle with this. And this is something that we really want. It's not only important for them while they're at SDSU, but definitely a lifelong skill that they're going to take into the rest of their lives. Like I mentioned, if you were on last week, I know Chelsea did a great presentation, our ECRT coordinator, on basic needs support, but we do have the ECRT under Wellbeing and Health Promotion. It's in our space as well. We really, as a campus, made the choice that basic needs was part of kind of living, you need it right in the hierarchy of needs to get to these higher levels of wellness and well-being. And so we do have this in our space. The ECRT is helping with food, housing, and financial insecurity. We provide holistic case management, and I think that's one of the unique things about the student or about ECRT and basic needs being in our space. We're not just assessing for basic needs when they come through. We're assessing for their mental and emotional health, physical health needs. Do they need connection with SASE? And we really want to take these students. It's a little bit tougher in a COVID environment with the economics issues that we see going on. But our goal, of course, is to take students from just surviving every day to really thriving. And we are working on getting them there with this holistic case management and getting them connected with all of the other resources on campus. I know many folks across campus, of course, are on the broader ECRT, and it includes over 50 campus partners. And then we're always reaching out to more folks and developing more relationships so that we can give a warm handoff to our students. So we know that when they don't have enough to eat or they don't have a safe place to sleep, it's going to be really hard to ask them to do things like, fine-tuned academic advising, right? So we want to help make that warm handoff to them so that way they can continue their progress while also getting out of their crisis situation. We're working on technology access support, which is something we were doing prior to COVID, but is more important than ever now. And then we also provide CalFresh enrollment support through our department. So we, again, have excellent partners off campus who, they're off-campus partners, but normally when we're all on campus, they are stationed full-time at SDSU. And right now we have full-time folks who are just dedicated to CalFresh enrollment for our students. So we have great inroads with that. Students, again, just go on, fill out a quick form online, get placed in a waiting list and can see our enrollment specialists. And we also have are partnering with the same organization for homelessness support. So for our students who are currently homeless or imminently homeless, we have a great deal of support for them, especially in the San Diego area. So of these students, please send them our way. Where we always have trouble finding these students, and we want to make sure that if you hear about a student, or maybe even if they're just overly tired, right, that might cue you in that they're having some kind of housing issue, and you can ask about that, and then please send them our way. And then, of course, our goal is to always get them towards self-sustainability. So what we're really hoping to do is bridge a gap in their resources and get them to the point where they're self-sustainable. We have a ton of peer financial educators too. So we have and staff who can support them on budgeting and helping them understand credit, helping them understand loans. And we partner with, of course, the Office of Financial Aid and scholarships on that as well. Lots of great resources here. So one thing that I wanted to talk about, this is kind of what drives the way that we see our work. We know that students come in with their own values, and often those are informed by their background, their families, their upbringing. They also have a set of information that they have access to, and then education, which we're always trying to improve upon and increase. But we know, they're coming to us with this values information that they already have in the education. And then there's also the access to resources and cues to action, and that's where we can kind of change things around too. We can provide greater access, we can cue them to action, give them this education, and all of these things really come together to dictate our student choices and behaviors. So we really see this as a complex issue. We're, again, not looking to force or kind of twist the arm of students to make specific decisions and behaviors, but really in our department, we're looking for that nudge, and we're looking for that sustainable change. So utilizing their motivations and their values to help create their own goals and then assist them in working toward that. And we see a lot more sustainable change when we do it in this capacity. We also, of course, want to make sure that we're thinking about the whole self. Right now, virus prevention is top of mind, but honestly was one of the things that we always focused on, because we know that illness, especially cold and flu, is one of the top 5 barriers students have identified in our National Collegiate Health Assessment that we put out every 2 years as impeding their academic success. And so we're always focused on this, but now more than ever. We also really want students to think about movement. The Aztec Recreation does a great job of, kind of that full-on exercise, but we try to make this a little more accessible to all of our students by thinking about it as more of movement, moving your body, and really trying to find the balance of physical activity, but also just doing things that are actually enjoyable, because we, again, want students to find self-care, physical and emotional self-care that is sustainable for them, and that they'll continue. When we think about nutrition and alcohol, we really think about that as fuel. So thinking about how do we want to fuel our body. We try to take we really focus on harm reduction techniques in our department. So of course we support all the policies that our campus partners put into place about alcohol and other drugs, but we try to err on the side of harm reduction. So we'll remind them of the policies, but we also do not take an abstinence only approach. So we really try to focus on, foods aren't good or bad. They're just doing different things for your body. And sometimes they're there to enjoy. And then we focus on, for those students who are engaging with alcohol specifically, and then sometimes with other drugs, a moderation approach. And then also that prevention approach. And the Narcan upstander distribution program is a perfect example of that. So of course, we want to remind students that there are risks with any sort of narcotics that they would be and opioids that they would be ingesting, but we also want to provide prevention if they choose to engage in those behaviors. And so we try to balance that as best we can. We have the healthcare we talked about a lot. We also, of course, want them to be managing illness with the prevention, but also with seeking care and making sure that they get access and that they don't just push off seeking care for their illness. We want them to, and we hear that a lot, right? And I'm sure you all do too, that students are too busy. I'm too busy to make that appointment. I'm too busy to follow up on this. And so really trying to highlight to them the benefits of taking action now, especially those smaller steps that can really avoid something bigger down the road. And then always thinking holistically. So making sure that we see health and well-being as mental, emotional, academic, and social health too. And we're seeing that again pop up more than ever before, right? Connection is so important and engagement is so important, and prioritizing that in our work. So moving on from that, one thing that I wanted to mention is that I think there's some specific ways that our colleagues can help students and help talk to them about the topics that we do, and be great partners when you're kind of on the ground to get access to the student. Maybe, you're kind of that first line of defense where they came to you first. We really want to encourage folks to guide students from the side rather than kind of telling them what to do, especially in the developmental areas that they're in. They seem to be more motivated and, like I said, do the behaviors more frequently when we encourage rather than tell them what to do with their personal choices. And this really allows students to be their own self-advocates, right? And that is, I'm sure you all experience this in your work too, but just so critical for their ability to advocate for themselves and in so many other aspects of their life. And we want them to do that with health too. So we don't want them to rely on their parents, although of course getting parental help is important. And we also don't want them to rely on campus partners as the only referral that they get. Referring is wonderful, but also just checking in and then encouraging them to do that themselves, and even offering like, hey, did you want to call, and I can stay on the Zoom and you can mute me right now, and why don't you make a call and see if there's anything they can do for you? Or, well, while we're thinking about it, why don't you just pull up the website and put in a request for that one-on-one education? Let's just get it over with right now. So you're still prompting them, you're giving that opportunity, but they're doing it. That can go a long way. And then it's easy, right? They're like, oh, that only took 30 seconds. And they build that confidence and self-efficacy to do it again the next time. Give advice, coaching, guidance, but as much as you can, resist doing it for them unless it absolutely need, there's going to be some students who we need to, but if given the opportunity, we would love for them to learn how easy it is and that they can do it and they're capable. And then we also want to encourage folks to talk directly with students. So if you see something's off, or if someone's working, like acting out of character, asking those tough, probing and open-ended questions. Is there something else going on here? How are you doing emotionally? I think with basic needs, really important. If a student maybe is really low energy, sleepy all the time, that can definitely be an indicator of food insecurity or housing insecurity. So asking them about that. And then helping the students self-identify those solutions, getting them to kind of come up with some of those solutions on their own. And again, building that self-efficacy. It's so easy just to say, oh, well, all you have to do is, all you have to do is just make sure that you're budgeting better, right? And then you'll be able to utilize your financial aid to make sure you have enough food. That's easier said than done, especially if it's the end of the semester and they've already spent it. So we want to make sure that we have them help self-identify the solutions and don't oversimplify those solutions for them. Remind them of the resources, encourage them to reach out. So, that's part of the reason why we do this education, to make sure people know what we have available and then have the ability to refer folks to us. And then also discuss any barriers that they may have encountered. So a lot of our students, especially, if they're indicating to you, I don't know, it's just not worth reaching out, that's probably because they've experienced a barrier. We're hearing that a lot from our students right now, that, they're always being asked to reach out to one more person or one more department. And so it can be really helpful to ask them, if you're hearing any sort of maybe ambivalence about taking the next step, or resistance in taking that next step, to ask them, have you tried reaching out before? What experience have you had with this department or this person? And then helping them break down those barriers. And that may be a time where you do step in, right? They're like, I reached out 3 times, I didn't hear anything. It's like, okay, great. Well, let me send an email with you, or let me reach out to them and have someone, email you. Would that be better? And so we can help break down those barriers. But if you're hearing that, if they're asking for help and then expressing ambivalence or resistance over any sort of action, then it's likely that they've encountered some barrier that we hopefully can overcome together. So that's all I had for Wellbeing and Health Promotion. But